let's go ahead and open up the doors. Hello, everybody. Welcome to Daily with Doc. My name is Becca Dukes, and as the hostess of this program, I am excited to be able to share something that just really changed my life for the good when I was in a state of very poor health. So now I am able to thrive and love life and look forward to growing old. As Dr. Wallach says, we have the potential to live to 120 years, which actually the Bible said it first. Dr. Wallach just keeps reminding us of that. This program is being brought to you by dailywithdoc.com, where we are a group of independent health coaches that represent a company called Longevity. We use the Longevity products as a solution to help us reach health goals and create a better health journey. So folks, one of the things that we love to do is to be able to share and love on people, especially those that love on us. And we have done a giveaway and we continue to do giveaways. And I am excited to announce who the winners are of our last giveaway. And I am going to go with not the grand prize winner first. We're going to go with those that are runners up. And each of these people will receive product from me as a thank you for helping us share this message. We have Debbie Voorhees, Charlotte Haynes, Curtis Browning, Jean Little, Marilyn Pizzera-Spear, Rebecca Kaiser, Olivia Harris, Greg Gilson, and our grand prize winner, Michelle Bousset. So some people may think, well, some of those people are your co-hosts. Well, guess what, folks? We love on everybody. We do not take away the ability for people to be rewarded for doing what is right. So like most places say that if you are an employee of the company that you do not qualify for this promotion, guess what? We are open to anybody and everybody because our goal is to make sure that our communities are reached so that together we can reach the world. So I just want to say congratulations to all of our winners. And I do see some of them are here with us. So thank you everybody for sharing. Now, if you would like to also be part of our next giveaway, go to dwdgiveaway.com and you can register for a giveaway. I want to make sure that you understand though, just because you check something does not automatically follow or on those different platforms. So you do have to follow through and you do, do a little extra stuff because we do check. So I just want to say thank you everybody for being here with us. And Joe Smith, thank you so much. As I see you out there on YouTube right now. And I think I forgot Aaron Reed as one of those people that are a runner up for the grand prize. So I want to let everybody know that you will be receiving a phone call from myself or one of our crew where we will be collecting your address so we know where to send your thank you. So with that being said, we can move on to the whole purpose of this program, and that is to provide empowering information to you as an individual so that you can be more of an authority and take charge of your own health. Now, that kind of sounds scary for some people, but folks, when you're working with somebody that has decades of research, and is one of the founding fathers of the science of epigenetics that has proven the genetic theory of disease transmission to be incorrect, it gives you more power and hope that your actions, what you yourself do, can create a different outcome for you when it comes to health. So it doesn't matter that your mother, your grandmother, your grandfather, your great-great-grandfather had some type of dis-ease Folks, epigenetics proves that what you have in your body, what you have in your environment, does play into how the genes are expressed and what things are going to happen within the body. And to share more about that with us is we have one of the founding fathers of the science of epigenetics, Dr. Joel Wallach, here with us each and every day on Daily with Doc. Now, if you are out on any of the platforms and you would like to join us here in the Zoom room, we are here Monday through Friday from 12 to 12:50 p.m. Pacific time. That's 1 Mountain, 2 Central, 3 Eastern, and you're going to have to do the rest. I know it's 4 Atlantic, but beyond that, folks, we can be reached by Zoom by going to dailywithDocZoom.com. Put that in the URL, not necessarily in the search bar, but in the URL address bar, and you'll be able to join us. And that is at the time of the show. So if you're not able to join us at the time of the show, we've got Rumble and YouTube and Facebook and Spotify and Amazon Music and iHeart and radio. I can't remember all of them, but we're out there meeting people where they're at so they too can create a better health journey for themselves. Now, if you want to join, or if you are already working with somebody to help you on this journey, make sure that you get back with them. They cared enough for you, about you, to share this program so that you can either ask questions or hear from Dr. Wallach specifically live. Now, if there was nobody to thank, I have a team standing by at our 800 number, 855-949-3377. That's 855-949-3377. And they're there to help you. Those are for people that are not working with anybody already, who have never tried any of the longevity products, because if you've already tried it, you have a distributor that is there to support you and help you in making decisions on what's going to be the best fit for you on your journey. So with that being said, it is my honor and privilege to bring to you Dr. Joel Wallach, Bachelor of Science in Agriculture, Doctor of Veterinary Medicine, 3 postdoctorates in pathology, and naturopathic physician, Dr. Joel Wallach. Hello, Dr. Wallach. Welcome to Daily with Doc.
Well, thank you for all the bringing us up the news, and thank you for the kind words, Becca. Thank you so much. And it's one of those things where we're an ever-growing community. I'm just so proud of the whole staff. Everybody's doing a great job. We just appreciate everything that's being done, because we are getting the message out. And in these days, things are pretty rough for everybody. And so, I mean, all these big grocery stores, they're struggling. So they're all joining together, making one grocery store. Like 2 or 3 different major brands of grocery stores, they're going together, making one grocery store brand. Okay, so when you have that kind of stuff going on, people need help. Okay, well, we're here for you. And let's see here. What do you want to talk about today?
Well, Dr. Wallach, I have had several people having pain in their face, between their ear, their jawbone, and it's thankfully it's not something that I experienced, but from my research and from talking to you and listening to you and also being part of this book, It's All in Your Head. I mean, that pain and discomfort is linked to trigeminal neuralgia.
Okay, trigeminal neuralgia. Yeah, it's very common. It's not quite as common as a pain in the rear end, but it's quite common. Okay, trigeminal neuralgia. That's the 5th cranial nerve being squeezed by osteoporosis of the skull. Okay, the fifth cranial nerve. Okay, there's 12 pairs of cranial nerve, one on the right side, one on the left side. And I get doctors to freak out because they'll have something going on the right side, and it didn't happen on the left side. Well, that's because you've got all this space in between the two branches and they're going different directions. And so that's why you have something that's a little puzzling to some people. But this is very easy. And of course, as you pointed out, there's the ocular branch, the trigeminal nerve. There's a maxillary branch, is where the cheek, and okay. And then there's the mandibular, the jawbone. All right. We're talking about some extreme pain. It'll bring you to your knees when you have trigeminal neuralgia. Okay, so the skull is squeezing that. And this sometimes goes along with people who have Parkinson's disease. Because when you have Parkinson's disease, you lose the, there you go, chapter 6, it's the 5th cranial nerve. Yeah. Okay, there you go. And it's in the book, it's all in your head. And this is why we wrote the book. Okay, it covers at least the 12 pairs of cranial nerves in the spinal cord. And there's like 37 different diseases you can get. Just the trigeminal nerve alone, there's like 8 or 10 different diseases you can get. Okay, because of the pain in different places and that kind of stuff. The doctor will examine you and say, you know, you may need to go to the dentist because you have this pain in your jaw. No, that's a mandibular joint being squeezed. Okay, when you have trigeminal neuralgia. But his brother is a dentist, and so he'll send you to the dentist who's his brother and so forth, and he'll pull some teeth and everything, and it won't help because that's not the problem. Okay, and so this is where education comes in, and I have to appreciate that. I think right now when you count numbers every day, every week, every month, it's all in your head. The book and the CD set are our biggest continuous sellers. Okay, that's set. It's all in your head. Now that's in addition to, let's see here, Dead Doctors Don't Lie. Okay, Dead Doctors Don't Lie. There's a big one. That one alone, okay, we have sold 40 million tapes of that book. 40 million tapes, 40 million. Okay, it's in 17 languages around the world. And so that's a great book, Dead Doctors Don't Lie, okay, along with It's All in Your Head, the book and the CD. And of course, we have the CD, the DVD, and everything else with it. So this is very simple to deal with. You deal with osteoporosis of the skull like you deal with osteoporosis. You got to get rid of all the bad foods and maximize absorption. Okay, no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, rye, oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin. Okay, but it's still gluten. Absolutely no buckwheat. Buckwheat doesn't have any gluten in it, but it has phagopyrines, which are 20 times worse than gluten when it comes to screwing up your absorption ability and so forth. So you got to give up the buckwheat pancakes and all that kind of stuff. And then absolutely no sugar, no carbonated drinks. Even the diet drinks got to go. And also the carbonated water, because carbonation neutralizes your stomach acid, and you cannot digest food or absorb minerals without stomach acid. And people say, well, stomach acid causes stomach ulcers. No, it doesn't. Okay, the stomach acid was put there by the good Lord. I mean, just think about it. Who made us? Who put us together piece by piece? Okay, the good Lord. Okay, we'll give him all the credit. And so we have the cells in our stomach to make stomach acid. We have cells in the pancreas to make enzymes. And this is all necessary for digestion and absorption. So you're going to get all this stuff. Just eating doesn't, by itself, isn't the total answer, because it could all be coming out the other end if you're eating gluten and buckwheat, so you can't absorb the nutrition. Okay. And so first thing I like to do when somebody comes in and I talk to them and ask them, do you have any other issues that might point out what's going on here? Tell me, do you have you lost your sense of smell? Have you lost your sense of taste? Has your voice changed? Oh, my voice changes and I have trouble swallowing. Okay, well, that's the 9th cranial nerve being squeezed. Okay, the glossopharyngeal nerve being squeezed by the osteoporosis of the skull. Okay, and what about auditory stuff and dizziness stuff. Do you have any thing going on where you have, there you go, where you have stuff like, um, you have buzzing in your ears. Buzzing in your ears is called what?
It's tinnitus.
Tinnitus. Very good. You get an A+. Okay. Tinnitus. Okay. So tinnitus, ringing in the ears, is the auditory branch of the eighth cranial nerve being squeezed by the skull when you have osteoporosis. And then when the vestibular branch of the eighth cranial nerve is being squeezed, you get balance problems and dizziness. I don't know why, man. I got to use a walker. I'm going to fall over. I feel like I'm seasick. Okay. And so there's, like I say, there's 37 different diseases you can get. 1 or 3 or 5 or 8 or 10 or 20 of them. You're going to be going to doctor to doctor to doctor. You're going to go to dentist. You're going to go to um, uh, every kind of physician and healer you can think of to try and solve these problems, which is actually quite simple. Okay, get rid of all the bad foods. Then you want to, let's just go for 100 pounds of body weight. But babies are born with osteoporosis of the skull. Okay, babies are born with it. Okay, and it's not something, it's just something for old age. And let's see here. So when you have osteoporosis of the skull, you want to make sure, get rid of all the bad stuff, all the bad foods, kind of bad cooking methods. And then per 100 pounds of body weight, you want 1 healthy brain and heart pack per month, 1 healthy brain and heart pack per month. And if you weigh 110 pounds or 90 pounds, you take a half a dose twice a day. So it's 1 dose a day of the healthy brain and heart pack. And then I want you to take 1 bottle a month of the MSM. So you can take 3 at breakfast, 3 at dinner time. If you weigh 150 pounds, okay, or more, I want you to take 2 healthy brain and heart packs per month. So you can take a full dose twice a day. And you take 2 bottles of MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. Then you want 2 of these canisters of the collagen peptides. So you can actually put 1 scoop in your morning drink and your evening drink, and that's going to help rebuild the skull, rebuild the tendons and ligaments and connective tissue all over the body, including the skull. Okay, and then we also, let's see here, want you to be taking our I-26 or I-26, because when you're having that stuff going on in your skull, the odds are you're also losing the complete value of your white matter of your brain, okay? The myelin is called. And so the I-26 will help rebuild the myelin and protect it from damage, okay, if you don't have any problems. And I take 2 or 3 of those twice a day minimum, okay, the chewables, but we do have capsules, we do have powders of the I-26. And it's one of those miracles. And if you have osteoporosis of the skull, you certainly want to be sure you're also taking the I-26. And also wouldn't hurt to take the synaptive, take 3 of those twice a day per 100 pounds of body weight. And they're going to help the brain cells talk to each other, okay? Because when you have osteoporosis of the skull, they're squeezing the brain cells, they're squeezing the nerves and so forth. And so you have to protect all of these various tissues, okay? So you can't just say, I take an aspirin. Well, you're going to go down the tubes very fast if that's all you're doing is taking an aspirin, okay? Because that's not going to give you resolution of the problem. That'll relieve the pain for a while, but as things get worse and worse and worse, these things get worse and worse and worse. It's very, very bad. But it can go away. Change your diet, do it correctly, and again, get a hold of that book and the CD set. It's all in your head. Get a hold of the book Dead Doctors Don't Lie. Get a hold of the book Epigenetics. And those 3 books alone can help you get through trigeminal neuralgia without having to go to 14 different doctors, because doctors want to make sure their brothers and their kids, have an income. So with that said, we see this all the time, and we have great results because we know what the problem is. And I think that's the advantage I have of being a pathologist. And I've done so many autopsies and looked at so many biopsies and so many slides from autopsy that I know what normal is, I know what abnormal is. And so it's very easy to put things together to fix them. Okay, so don't look at age as being the only criteria for some of these things. Age is not a disease producer in of its own self. Okay, Becca, what else we have on trigeminal neuralgia?
Well, Dr. Wallach, I think you covered it pretty well. I mean, you've got pain here, but that's not where the pain is stemming from. It's from being squeezed back here, right?
Well,
That nerve that
it's
comes
being
around.
squeezed in the skull, and that's the beauty of this book. It's all in your head. When you look, let's see here, there's a chapter here. There's 12 chapters. Okay.
Oh, yep, I've got that one.
Okay, there you go. And then there's a picture of the bottom side of the brain, and you see all these 12 cranial nerves coming out, and you see it's going to various organs and things, so you know where they're going. And this is how important the myelin, the white matter of the brain is. This is how important it is to eat right, so all these tissues are happy. Just think of that. Look at that array of tissues that are being affected by what goes on in the lower part of the brain. Okay.
All of those are all different parts
Yeah. And of
of the
course,
body.
on the adjoining page, see those gray lines and white lines alternating. Those are the 12 pairs of cranial nerves. Okay. Each one of those chapters. And so each chapter, they're not long. They're, in some cases, they're just one page. In some cases, they're 2 pages. They're not long. It's a very thin book, but it covers what diseases you get when these nerves are being squeezed. And so you can, when you go to the doctor and he says, oh, we got to do this, we got to do that, and send you to this expert. Well, wait a minute, doctor. You whip out it's on your head book, and they will freak out. They have never seen that. They don't get taught this. They're only taught about these nerves below the shoulders. They don't get taught anything about the nerves from here up because, well, that's what dentists are for.
Well, the thing that gets me, Dr. Wallach, when it comes to nerves and pain, they're wanting to burn those nerve endings to
Mhm.
stop the pain. And that just does not make sense to me. Why kill something? Because you need feeling. You burn those nerve endings, you're not going to have feeling. So when something happens, like you cut your finger or gets too close to something hot, you're not going to feel it. It's going to create more damage to the body. Am I wrong?
No, you're correct. And of course, you have to appreciate that in human beings, we want instant results. Well, my doctor, he gave me this treatment. Man, my pain went away and I've never had that pain again. But other things are happening that are probably worse. Okay. But that's why doctors do those things because they get compliments because it stopped the pain immediately and they haven't had any more of that pain ever in 20 years. But when you look at what's going on there, well, I've been to the doctor. I said, how many times have you been to the dentist since then? Oh, gosh, I don't know, 20 times. I had all my teeth pulled and I have all the false teeth and everything and implants. Why was that? Well, I just had so much pain. And what did the doctor say? Well, he said, well, I had to stop eating candy and sugar and stuff like that because I was, causing problems in my teeth. No, that was
Well,
the
it
brain
does
was
lead
being
to,
squeezed, and the maxillary branch of um, the thing called the trigeminal nerve was being
yeah.
squeezed.
Well, thank you so much, Dr. Wallach, for covering that in depth today. I know it's going to be beneficial and help a lot of people that have been incorrectly told the cause of that pain. So, folks, that's trigeminal neuralgia, and that's cranial nerve number 5.
Yeah, and it'll turn if you treat it correctly, avoid all the bad foods, do all the nutrients, it'll turn around in weeks, in just a couple of weeks. And of course, you can put we have 2 sources of pain reliever. You can put our CM cream on your face where you have the pain, right? You can also take our, let's see here, it's
The
the
Soothe,
what?
Soothe from our Hemp FX line.
Yeah, the Soothes from the Hemp FX. You put the Soothe on there, okay, and get pain relief for a couple of hours, okay. And it's one of those things where I would go that direction, get on the proper diet and proper supplement program, get rid of all the bad foods, and then put the topical pain relievers on, both the CM cream and what's the new one, and it has the 2 metal ends.
Or
The,
that's the Soothe. That's a soothe. But folks, from my experience and working with Dr. Wallach and going from being in so much pain, when I got on the good foods, bad foods list, which you can find at dailywithdoc.com, and then get on the supplement program because they work together. You can't out supplement a lousy diet. When you're taking in a bunch of carbohydrates and a bunch of sugar, that increases inflammation in the body, throughout the body, which then limits absorption as well.
Yeah, the villi go away. You lose your absorptive cells.
Yeah, so take that factor out. It mindset makes it difficult. But when you understand what it's doing to your body, then you are able to make wiser choices in what's going into your body so that you can choose a better health journey and then get the best absorption from what you are putting in your body that is supposed to be building and lifting up from the inside out as we're working on this cellular level. So, Dr. Wallach, I do have to say that this program is meant for educational purposes only. The FDA requires us to let you know that this program is not meant to take the place of your primary care physician, nor are the products mentioned meant to diagnose, treat, cure any diseases. But folks, when you give the body what it needs, the body itself can do some amazing things. I've felt it, and that's why I'm so excited to be able to share this with you today. So, Dr. Wallach, we have hands up with questions. So let's go to the first hand that is up. And Maria, go ahead and unmute yourself.
Hello, Maria. How can we help you?
Hello, can you hear me?
Yes.
Hi,
Hi.
Dr. Wallach. Thank you for all you do. I'm a new distributor, about a year now.
Well, thank you.
And I've been on the products. It's kind of fitting with our topic today. I was on the products. I started taking them from osteopenia. And I was been taking for the last year. I've been doing the 90, the collagen, the glucogel, the MSM, the rebound, because I'm also a runner, the cherry mints, the I-26, the hair, skin, nails, selenium, and immortalium. I take that every day religiously. I've not missed one day.
Do you take the rebound or sports drink?
Yes, I take the rebound because I'm a runner.
Okay.
So I take the rebound every day. I take all those products. Like I said, I've not missed a day. And I had the osteopenia of the skull because I had chronic vertigo for like 12 years. Chronic back pain, first thing out of bed for about an hour for about the same time, about 10 years. I had visual changes in my eyes.
Let me interrupt you there. Sure. How many times at night would you wake up to urinate? Once, 3 times?
I usually didn't.
You didn't? Okay.
I didn't, yeah, but I had really bad vertigo that I battled for, like I said, about 12 years.
Wow.
And it just kept getting worse and worse. And I had even some like changes, like my teeth were shifting. I could even feel I didn't know why, but I always felt like my skull bone was very sensitive. Like I could feel the divots in there. And I could feel the tenderness in my bones, like on my shins and my long bones. So I've been taking the products religiously for the last year. I did a Dexa scan 2 years ago, and I feel great. Like I have the vertigo within, a month or so was gone. The visual changes were gone. My back pain, I feel great. I'm 100%. I have no symptoms. It's just been a miracle for me.
Well, thanks for sharing your story.
Yeah, it's been great. I feel like you saved my life. You absolutely saved my life. And I'm 5'3", like 115 pounds. So I take, just one, it's the monthly supply. I don't take any more. Sometimes like at the beginning, I was taking extra of the osteo. But my question is, I had a Dexa scan 2 years ago. So I don't know how accurate those are because my lumbar spine showed I was at like -2.4, which is osteopenia. And according to the scan, -2.5 is osteoporosis. And my hips were normal. So now I just repeated my Dexa scan and it shows that I've gotten worse.
Okay. And you're talking.
And I'm off the 12 bad foods, but like I said, I feel amazing. All of my symptoms are gone.
Okay. All right. And so basically what we want to do here is make sure you're optimizing your mineral intake. Okay. And so basically, I would make sure that you're taking the let's see here, Beyond Osteo FX.
I take all the 90. I said I've not missed a day. I
Okay.
travel. I've been religious with it. I even take the cherry mints because that has extra
Okay.
collagen in there. I
Okay.
take extra collagen.
Take extra collagen,
I
good.
take extra collagen. Yeah, I
Okay,
take
one
all
more.
those products
One more. Where do you live?
in Wisconsin.
Okay. How many vitamin D3 capsules or tablets you taking per
Oh, I
day?
also do take vitamin D. I'm sorry. I do take vitamin D as well.
Okay.
You know, it varies. I take less in the summer because I do spend a lot of time in the sun.
Mhm.
If you, I don't know, I'm super tanned. And so in the summer, I do spend a lot of time in the sun. And I do in the winter, I also cross country ski, so I'm always outside, but I do take more in the winter and less in the summer.
Yeah, I would take 2 of your vitamin D3 tabs uh, 3 times a day, 2 or 3 with each meal.
Okay.
Okay, go there and make sure that nobody in your environment is eating gluten or buckwheat. Okay,
Yeah.
so that you're not getting cross contamination in the laundry and the couches and the rugs and the bed,
Yeah.
all that kind of stuff. Okay.
Yeah. It's just me and my husband, so we're both gluten free. But I just thought, are those tests really that accurate, or is there a better test? Because I can't imagine that I feel this fabulous and it's gotten worse.
Well, you can get an MRI, okay, which is a
Okay.
magnetic resonance imaging, so you're not getting any radiation or anything like that, MRI,
Okay.
and that'll tell you if you have osteoporosis.
And would I do it on the spine,
I would do it on the
MRI?
spine and the pelvis.
Okay. Um, because I also had like a really bad bike accident back in May and walked away with
Mhm.
not even a pulled muscle. So
Mhm.
I can't imagine that that test is accurate when I mean, I didn't even fracture anything. And I mean, if I would think if I had osteoporosis like the Dexa showed, I
Yeah.
would have had a
So
bad
did your
break.
doctor say you're remarkable because you didn't have uh,
Yeah, they were amazed. Even it was a bike trip with a organized group, and they said everybody who does this always fractures their collarbones. And I'm 52, and I said I got back on the bike and continued riding. It was amazing.
yeah.
So I just thought there's another a better test to show because I
Yeah,
just
get an
don't
MRI and
believe
then
those
call us back.
results.
Let us know what the MRI said.
Okay,
And thank you for sharing your story. God bless.
yeah, it's been amazing. Thank you.
All right. Thank you, Maria. And I do have to say 52 is pretty fabulous. Looks good on you as well. So that's amazing, Dr. Wallach, to have a bike accident like she explained and to walk away from it. And one thing that I do want to add in is with the CM cream, you can mix things with the CM cream. And I would recommend mixing clary sage essential oil, which you can also get through Longevity. It helps and promotes the absorption of calcium into the bones. So give that extra little, pull into the bones by using clary sage essential oil. So that would be one thing that I'd recommend for you, Maria. But thank you, yes, very much. And as you said, you feel like he saved your life. I'm right there with you, sister. Definitely. Let's go to the next hand that is up, Dr. Wallach. And we have somebody on an iPhone. Go ahead and unmute yourself.
Hi there, my name is Rhonda. I'm not quite sure why that doesn't show up.
All right, Rhonda, thank you for joining us. You're on live with Dr. Wallach.
Thank you. Hi, doctor.
Hello, how can we help you?
Hey, I appreciate you and taking my call. I am personally on your products myself, the Tangy Tangerine, the minerals, osteo, but I'm actually calling for my cat, if that's okay. I'm kind of getting some runaround with him. He's a 4-year-old male orange tabby. He has a history of bladder crystals, but I guess somehow he has now developed hyperesthesia, which I guess is like twitchy back and tail. And they're wanting me to take him to the university. And I'm like, they want to do CAT scans and ultrasounds. And I'm thinking, okay, here's thousands of dollars. What am I missing? Why
Okay.
did he bladder?
What are you feeding the cat?
I'm sorry, what?
What are you feeding the cat?
Well, they wanted me to put him on this.
No. What are you now feeding the cat?
He's on, well, he doesn't like the prescription diet. I'm feeding him like a higher protein meat cat food kibble.
Okay, now let's back up there. Is this a dry kibble?
Yes.
Okay, and this is a commercial cat food.
Yes, but it's one of the higher grades. It's called Instinct.
Okay,
And
does it have vitamins and minerals added to it?
I would have to check that. I'm not sure.
You got to read the label, make sure there's vitamins. A lot of times they just put the meat in there and there's no vitamins and minerals added.
Yeah,
And so then also, and how much does a cat weigh again?
10 pounds.
10 pounds. Okay, good. I also want you to get the, let's see here, the Arthrodex. Get our Arthrodex. Cats love it. And it's 1 scoop for 20 pounds of body weight. So if the cat weighs 10 pounds, it'll be a half a scoop every day in the food. Okay. And that's going to give remarkable amounts of nutrition, including a focus on vitamins and minerals added to it. And it does have fish livers in there. So the cats love it. Okay. And then give us a call every couple of weeks. Let us know how it's going. All right. That's
Okay. Does that help with the bladder crystals and the hyperesthesia?
Oh, yeah, absolutely.
Okay. So this is more like a mineral deficiency than.
Yes.
Okay. Because they're wanting to do all these scans and tests. And it's like, I don't know if I want to do thousands of dollars worth of testing on them.
Well, see, that's because this is the time of year they need money.
Okay. Yeah, they have them on gabapentin right now to help with it.
They weren't going to give you all these tests for nothing, right? They're going to charge you.
Oh, of course. Yeah.
Okay. Yeah, I'd go. I'd go with the Arthrodex. Okay.
Okay.
Yeah. Call us every 2 weeks, Rhonda.
All right. I can do that. Thank you.
Thank you.
All right, Rhonda. Thank you. Thank you. And next, let's move right over to TC. TC, go ahead and unmute yourself. There you go.
Back. Hi, Doc. I have a quick question about my brother's dog today. He is a Labrador Newfoundland Retriever. He's 13 and a half years old. He has a degenerative spine disease all the way down to his tail. Now, usually he's in good spirits, but once in a while his hind leg will collapse and he'll fall down.
How much does he weigh?
Well, he's a Labrador Newfoundland Retriever, so kind of a big dog.
Yeah, I'm going to say over 125, Doc.
Well, I don't know if he's that much, but
okay, so let's say 90 to 125, somewhere there.
Now, I know that for years, every day they've been feeding him dog food. I think that has wheat in it, and they've been giving him tap water every day too.
Okay, well, if it has wheat in it, he's got a gluten problem, and so he's not absorbing all the nutrients. Okay, so you got to read the labels very carefully. And then I want him to have Arthrodex. I want him to have 4 scoops of the Arthrodex a day. Okay, it's 1 scoop for 20 pounds of body weight. So 4 scoops a day of the Arthrodex added to the food, and that's going to get the nutrition that this guy needs. Okay, and so let's start there.
Okay, what's that
called?
That'll
that'll help rebuild the vertebrae, the pelvis, the long bones in the legs and ribs and so forth. Okay.
Okay. All right.
Okay, let's hear from you in a couple of weeks, but it's the Arthrodex.
Okay, thank you.
You bet.
All right, thank you, TC. And let's move right over to AJ. AJ, go ahead and unmute yourself.
Hello, Doc. How are you?
Okay, sir. How can we help you?
Sorry about that. I have a gentleman in Saudi Arabia concerned about his dad who has had a history of gallstones. They removed the stones. He's most concerned about the FTD and Alzheimer's and the fact that he's lost a tremendous amount of weight. He's wants to know how he can improve his stiffness, his Alzheimer's symptoms, and about how long would the program take him to get better.
Mm-hmm. Yeah, and he might even have some Parkinson's disease in there with some of the symptoms you're describing. Okay. So at any rate, and your dad weighs again how much?
His dad is 128 pounds now, and
Okay.
he's about 5'9" and 69 years old.
Okay, so none of the bad foods, everybody in the household. Okay, so there's no cross-contamination in the wash and the couches and so forth. No bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no brown rind oats, no sugar, no carbonated drinks, even the diet drinks, and the carbonated water got to go. And then 120 pounds, I'm going to have one healthy brain and heart pack per month, a half a dose of everything twice a day. I'm going to have, I'd go with 2 bottles a month of the MSM, so I can take 3 at breakfast, 3 at lunch, 3 at dinner time. They're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone itself. I also want them to have the, let's see here, I'd go with the synaptive, take 3 of those twice a day. It'd be 2 bottles a month so the brain cells can talk to each other and talk to the spinal cord. I also want them to have the I-26, okay? You can take 2 or 3 doses a day of the I-26, so it'll be at least 2 of those bottles a month of the I-26. That's going to help him rebuild the myelin, the white matter of the brain, the spinal cord, and all the coverings of all the big nerves around the body, okay? Including the sciatic nerves, you know, where the spinal cord splits into the right and left sciatic nerves. And so the FTD, frontal temporal dementia, that's Alzheimer's disease. It's kind of a cousin to you know, things like the let's say Alzheimer's disease, MS, multiple sclerosis, Parkinson's disease. And so it's one of those things where that's why I threw in the
I-26.
yeah, thank you, the I-26, yeah. Okay, and call us every couple of weeks, let us know how he's doing, because these folks, the brain and spinal cord turn around very quickly when they get the I-26. It's been a miracle. I've seen miracles happen with the I-26, okay, with the FTD, with everything from Parkinson's disease to people who have dizziness, you know, they have ringing in the ears, tinnitus, and all that kind of stuff. That all goes away pretty quickly. Okay.
Thank you very much, Doc.
Thank you, AJ. Okay. Yeah, we have to take care of our brothers and sisters all over the world. So that's something that's not unusual for us. Okay, we have time for 1 or 2 more quickies here.
All right, Dr. Wallach, I have Al asking a question out on YouTube, asking in regards to a female, 43 years old, 150 pounds, 5'2". She's had 21 years of infertility where she has had over 10 IVF, only getting pregnant 3 times and each ending with a miscarriage for unknown reasons. One was an ectopic pregnancy.
Yes.
Her gallbladder has been removed. She also always has ear infections, so she's hearing impaired, high blood sugar, but not on any medications for it. She has pain in her lower back, inflammation in her gums. She's fatigued, has difficulty sleeping, and she really wants to get pregnant, Doc. What can we recommend for her?
It's going to maybe take 6 months to a year to get her ready to get pregnant with all these things, okay? Get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, rye, oats, no buckwheat, no sugar, no carbonated drinks, even the diet drinks and the carbonated water need to go. And at 150 pounds, I want her to have 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. When I say no to the bad foods, if she has all these things going on here, she's eating gluten and that's got to stop. Her diet is what's causing all these problems. Okay, so 2 healthy brain and heart packs per month, a full dose of something twice a day. Then she needs 2 bottles of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. They're going to help rebuild cartilage and ligaments and tendons and connective tissue and all that kind of stuff. She needs also needs the collagen peptides, to scuba that with her morning drink, scuba with her evening drink. I also want her to take our sweeties. She can take 3 of those twice a day. That'll help her with her blood sugar issues. Let's see here. Then we also need her to use our rebound or sports drink. Okay, instead of soft drinks and tea and coffee and things like that, I want her to drink our Rebound, okay? And we do have the powder in the canisters. We do have the sticks. They come, you know, they kind of, yeah, there you go. We have the sticks, and it has 75 minerals in it, either the powder as you're holding up and the stick as I'm holding up. And okay, and they have 75 minerals and 25 vitamins and amino acids. I don't think the cans will get there if she's in a foreign country. They don't give them the cans.
Nope.
It's just either the powder or the sticks. Okay, and then this is something, got to clean up the diet and take all these nutrients, and of course you're getting another 75 nutrients when you take our Rebound sports drink.
Did you mention Xerafem?
I did not. I purposely didn't add Xerafem because I want her to be on all these other things first for say at least 3 to 6 months, because she's having all these pregnancy issues and this and the other. And I don't want her to keep getting pregnant and having, you know, a disaster again and again and again. So I'm not pushing her fertility until all these other issues go away.
That's smart, Doc.
Okay.
You get an A+.
Oh, thank you.
All right. So Al, I hope that helps you in helping your client. Thank you so much for asking that question. Now, going back to the cat thing, Dr. Wallach, we had a comment here that it sounds like that our pets even need to be on the good foods, bad foods list.
That is correct.
So no wheat, barley, rye, or oats, no bottled oil. You do need to read the labels of your dog food. I don't care who recommended it, and I don't care how much it costs. Read those labels. Right, Doc?
That's right, because we don't want any gluten or buckwheat in those dog foods. We want lots of vitamins and minerals, but no wheat, barley, rye, oats, or buckwheat.
And then one more quick question. It has to do with the crystals that are found in cats. Are they the same as kidney stones in humans?
There's sort of a, what should I say, there's a lot of minerals in the urine. Okay, lots of minerals in the urine. And again, that has to do with things missing in the diet, because those minerals should be properly deposited in the bones and this and the other. They may be being pulled out of the bones because your body's recognized, the cat's body's recognized doesn't have enough circulating minerals, so they're pulling minerals out of the bones. Okay, so or from the stores in the liver.
Awesome. All right. And then one more quick question, Dr. Wallach. So if broken bones can heal, why can't teeth heal from cavities?
Okay, that's because teeth are not porous tissues like skin. Their skin and bones are kind of very similar, you know, when you talk about them chemically. Okay, but a tooth is like poured concrete. It's a different tissue. Okay, and so it's one of those things where you can't repair a tooth. That's why you have to either drill out a hole and put in some, you know, of the stuff in there to fill the hole, or maybe take the tooth out and put a implant in, false implant.
Okay, so going with false implant and doing the jaw drilling and all that stuff, if your jawbone is porous and unhealthy, drilling into it is not going to make it any better.
That's correct. You'll still have issues.
So if your teeth are loose and falling out, drilling into it, folks, is not fixing the problem. We've got to work at the cellular level, looking at your nutrition, looking at what you are intentionally supplementing with to support healthy bones.
Now, don't you find it interesting? The dentists don't, as a profession, they're not big on telling people about supplements.
Not many in the medical fields are, Dr. Wallach. That's why I like to go with naturopathic physicians, functional medicine, because they look at the bigger picture and not so much just throwing a chemical to mask the symptoms.
Okay, well, I apologize, but I do have to
You
run.
gotta go. Thank you so much, Dr. Wallach, for being here with us on Daily with Doc. Folks, if I could get my co-hosts on the screen with me, that would be greatly appreciated, as I could not do this without them. So it takes a team. We have Sherry, who is helping put information in the chat. She's letting people in. She's helping me watch cameras so that if there's things that are distracting, taking away from your ability to actually focus on the meeting, if you're here live with us, she is helping me keep that under control. So is Ruth Ellen. And then we have Fingers. We call her Fingers because she's so good at typing and dictation. We have the beautiful Marilyn, who is putting the information into the chat, which is one of the biggest benefits of being here with us in the live Zoom. Monday through Friday, 12 to 12:50 p.m. Pacific time, dailywithDocZoom.com, is you will be able to see exactly what Dr. Wallach recommended for the individual that asks the question, because Marilyn puts it there. She does such a great job with that. So we want to say thank you, Marilyn. And we have AJ, who is helping with all of the different social media platforms and making sure that we are streaming where we're supposed to be streaming, and also fielding questions and helping to answer those questions, as well as the assistant production manager, and of course the production manager, the executive production manager, Ruth Ellen Sanchez, who is helping pull it all together. I just want to say thank you, as she is my right hand and my chosen sister. Folks, we are family, not only just business partners, but we are family. And we have a passion that pulls us together to help people. If that's something that you have, that heartstring pulling at your heart, and something that you would like to be more involved in or get started in, we open this opportunity up to anybody and everybody. Get back with the person that shared this program with you. If there is nobody to thank, you can find out more about our Certified Holistic Health Coach course by going to coachwithdoc.com, or you can also reach us through contact on our website, dailywithdoc.com, and ask your questions of us, and we will get back to you, either myself or one of my crew. And don't forget to enter into our next giveaway at DWD, that's Daily with Doc, DWDgiveaway.com. So folks, share this information with others, whether it's to help them as a human being or to help them take better care of their fur babies. That's what we're all about, is creating healthier communities around the world. And that includes all things that breathe. So until next time, thank you again for joining us here on Daily with Doc. My name is Becca Dukes, and it is my honor and privilege to be able to bring this information to you. Bye for now.